Hi everyone, welcome to the 8th session of the CBT class. Today you will learn about homework in CBT. You've been exposed to some contents related to homework when learning about how to structure CBT session because homework is an integral part of every CBT session. Today you'll delve into more details about how to administer homework and what to consider in administering homework and how to address some challenges in completing homework. So let's begin. Some introductory information about homework. First of all, homework is a routine strategy that's used in a lot of different therapeutic interventions, regardless of theoretical orientation. So homework is not just unique to CBT, but it's widely used in other types of therapy as well. And research shows that clients who do the most homework improve more than those who do little to no homework. So not only that, doing homework increase the chance of getting better in therapy, but also there's a dose and response relationship, which means that the more consistently you complete homework, the better you get. And also research shows that CBT is more effective with homework than without. So there is a clear evidence that completing homework in CBT is beneficial for clients. In an article that Dr. Beck wrote in 2016, she encouraged the use of the term action plan instead of homework to emphasize the sense of proactivity and autonomy that's involved in completing homework. She also suggests that action plans are not optional. Like I said, homework or action plans are a really integral part of CBT therapy. And that's because it's not enough for clients to just show up in session and talk for like 50 minutes or to an hour every week. That can't really help that much for our clients to get better. Dr. Beck really emphasizes that people get better by making small changes in their thinking and behavior every day. So actually, it's not the weekly session that you have where you can expect the most changes happening. That weekly session is just a place where you will introduce all these skills, but it's the most important changes happen outside the therapy. There are multiple benefits of completing homework in therapy. As you saw, that research support the idea homework helps clients get better and improve more. It also helps clients to assume more responsible, active roles in the change process. And therefore, homework helps to increase clients' motivation and commitment to change. Also, homework creates some tangibility in the work that you do with your client. How is what we talk about in therapy applicable to real life? So it gives a chance for your clients to apply what they learned in session outside of therapy in real life and then start seeing difference. Some of the example activities that are most frequently assigned as homework in CBT includes reading therapy notes every day because it contains all the important information regarding the major issues that your clients are struggling with, and then solutions to work on improving those issues and implementing solutions to problems. Many of you will be working on helping your clients to develop some problem-solving skills. And then those skills need to be practiced outside of therapy in real-life situations. Also monitoring experiences to notice important automatic thoughts and respond to their negative cognitions by reading coping cards or therapy notes or using worksheets. So like you practice completing that 3-column worksheet or 7-column worksheet to become more aware of negative automatic thoughts and to practice skills to change a negative thoughts into more helpful and adaptive way of thinking. You will assign those activities as homework to your clients to encourage systematically for your clients to become more aware of their negative cognition. And also a lot of behavioral skills that you will be teaching in sessions, such as activity scheduling, which you learned as part of the behavioral activation, self-care, exercise, activities that bring a sense of pleasure or mastery, which you worked on in class. For clients with anxiety issues, exposure is a really important component. And then your clients needs to be exposed to real life situation that increase their anxiety. And a lot of other skills such as social communication, assertiveness skills, emotional regulation techniques, mindfulness skills, relaxation skills. A lot of these skills that you will be working on in session. So once you teach those skills, your clients will have chance to practice that outside of the session. So these are some of the examples of homework activities that you will assign to your clients. So you've learned that homework is really integral part of CBT and it's very beneficial for clients to complete homework. But what percentage of clients actually do complete homework? So research shows that about 20 to 50% in adults and about half, like 50% in adolescents would actually complete homework. So that means that about half of clients do not complete homework. And there are reasons why clients would not complete homework. And then there are some internal reasons, which include a lack of motivation to change the situation when experiencing negative feelings, particularly clients with depression. They, have this consistent low energy and lack of motivation to engage in change. And also inability to identify automatic thoughts. So some clients just lack skills to successfully complete homework. And there are clients who disregard the importance or relevance of doing homework. And they don't really see the point of completing homework. There are some clients who tend to want to see immediate results and working on these skills in session and then like keep practicing and repeating outside of therapy requires persistence, and for some clients persistence is really difficult quality to have. There are also some external reasons why clients don't complete homework, such as the effort associated with pen and paper homework formats. You notice that a lot of CBT homeworks tend to use worksheets, and some clients just don't like having to use a pen and paper. Completed homework is time consuming, and not understanding the purpose of the homework, again, that ties with not really seeing the point of completed homework. And then lack of instruction. You give out homework, but clients don't really have a detailed instruction of how to accomplish like smaller steps to achieve completing homework. And then failure to anticipate potential difficulties in completing the homework. When you are talking to your clients in session, feels like it's feasible, feels like they could do that, but there are a lot of unanticipated challenges that come up that makes it difficult for them to complete homework. And then there are some therapist reasons, and obviously these are actually related to some external reasons that why clients don't complete homework, such as not giving enough instruction about what to do, not making sure that clients have the necessary skills, also not making sure that clients understand the rationale, like, seeing the purpose of completing homework, and also imposing the homework instead of developing it collaboratively. Homework actually may be a part where the collaborative empiricism, the principle of collaborative empiricism applies most heavily, because the clients actually has to do this thing on their own, and when you're not going to be there when your clients complete homework. So it is very, very important that you collaborate with your clients to come up with the assignment that they are likely to work on. Also, not really understanding like how difficult a science can be for your clients. Again, that's why it's important for you to have really in-depth understanding of your clients' surroundings, so that external environment, as well as your clients' like internal ability to complete homework. And also, therapists not making sure that clients have time for assignments and understand how long they should spend on an assignment. And this is why it's very important for you to really, break down the homework into like smaller steps, and really like walking through each step with the client, exploring their ability to actually work on those smaller steps so that they can complete the homework. So it's helpful for therapists to have some understanding of why clients might have hard time completing homework. So reviewed some of the internal reasons, external reasons, and some of the therapist factors that may be contributing to homework non-compliance. There's also some known mediators and moderators of a homework completion. So if you have taken like basic research course, you should know what those really mean. But basically, those are like some factors that would influence clients' completion of homework. So homework beliefs is one of that. Like it's a client's believing in the homework. So research shows that higher client homework beliefs, which means that like the more your clients feel positive about doing homework, significantly predicted greater homework engagement. So basically, if your clients believes in homework, then they are more likely to complete homework. Perfectionism is another factor that can influence clients' homework compliance. And the mechanism through which perfectionism can influence homework compliance could have like two different ways. First of all, perfectionists, they tend to get into this cognitive distortion of absolutistic thinking or black and white mentality. And because of that, they don't see the point of starting something if they can't see the possibility of completing something perfect. So a lot of times perfectionists tend to procrastinate, or not start anything or abandon something like midway if they feel like they cannot produce something perfectly. Perfectionists can they also have a tendency of setting like unrealistic goals, and because of that, it's always like anxiety provoking for perfectionists to plan things, because when they come up with this goals that are not really attainable. And then there is this anxiety that I won't be able to complete things like perfectly. And then because of that, they don't really complete homework. So it's helpful to consider these things when working with the clients with perfectionist traits. So far, we've looked at some of the barriers in completed homework. And then let's talk about some of the factors that can facilitate clients' homework compliance. And then one of the most important thing is the acceptability. Clients will usually accept homework if it meets the following 4 criteria, which includes like the fit between the problem and the homework. So helping clients to see the purpose of completing homework and how that's relevant to what they're working on in session, that would be really important. And also clients' perception that homework is achievable. And also homework builds upon clients' strength. And then there's a strong therapeutic alliance. So these are like, foundational kind of things that needs to be in place for your clients to accept homework as part of therapy process. And some other facilitators of homework compliance include a therapist following up a client-initiated idea. That also goes in hand with the principle of collaborative empiricism that we talked about. Your clients provide their input, they take initiatives, and then you listen and value those ideas, and then you follow up. So that really helps your clients to keeping motivated and taking active role in facilitating changes. Also highlighting the right readiness and willingness to carry out homework. So really, that psychoeducation piece, explaining the role of client and your role as a therapist in the context of CBT, that can reinforce your client's active participation in completion of homework. Also defining the task specifically and concretely. I think I mentioned this term, task analysis, which is based on the behavioral principles, breaking down steps into like smaller and concrete steps. And that helps your clients to see homework much more achievable and doable. Using encouragement and strength building, again, that positive reinforcement is really important to engage your clients in completing homework, and also rehearsing and elaborating in session. So, give a chance for your clients to work on skills that they need to do homework in session. So just help them rehearse those skills, and then elaborate how they can use those skills to work on homework. And seeking a contractual agreement or commitment from the client. You may be familiar of writing that suicidal contract with your client, and then oftentimes, when you have that contract, I mean, it's just a piece of paper, but clients tend to give meaning to those contract and agreement. So kind of putting that as part of your session structure can be helpful to draw more commitment from your client. Also examining and problem solving barriers to completion. So I think I repeatedly said this in class, how important it is for you to anticipate challenges and then problem solve to overcome those barriers. So as part of your effort to facilitate homework compliance, it's always important that you ask this question: how likely for you to complete this homework toward the end of the session when you assign the homework, and elicit feedback from your clients. So if your clients show some sign of reservation, if it's like less than 90% likely that they will do homework, then you can explore some ways to make the homework a little easier. Maybe you can break it down into smaller steps and then have the clients complete just initial, like first 1-2 steps. And then once your clients feel comfortable taking that like first 1-2 steps, then you can add additional steps in the following week. And because your clients have a psychiatric condition, and then often have this negative automatic thoughts, your clients actually might have some negative automatic thoughts that they have when thinking about homework. So exploring that automatic thoughts and kind of looking at ways to change that automatic thoughts into more helpful adaptive thoughts could be an important preparation for your clients to complete homework. Also, anticipating challenges, as I kept mentioning, identify problems beforehand, and then engage in some problem solving processes. And then after that, you always reassess the likelihood again, and then see if your clients feel more comfortable to complete the homework. So while you're engaging your clients in completing homework, again, always remember that it's actually not you who's in the driver's seat. It's always your clients who's actually driving this change process. And you're just there in the passenger seat, and you can provide guidance and then give direction and make suggestions. It's ultimately your clients who make the decision where they want to go. And then they're the ones who would need to be navigating the car. Another very important thing that you've heard like again and again repeatedly is to always follow up. Because if you give assignment and don't follow up, then that gives a message to your clients that it's not really important, and then also that creates discouragement. So make sure that you always follow up. And how do you follow up? You ask these questions. Can we take a look at your action plan? Again, if you keep the therapy note, you can take a look at that together when reviewing that therapy note from the previous week, and ask your clients, what did you get done? And also, what did you learn from doing homework, so that your clients can draw some conclusion from engaging in that homework activity, and then apply what they learned to other situations. It's also important that you're conscious of your own thoughts getting in the way of your client's homework compliance. For example, when you're about to review homework, follow up with the homework, you may be thinking, what if the client didn't do their homework? They're non-compliant, they don't want to be in treatment, they'll not change, they were not listening when I assigned the homework. What's the point? I should stop recommending homework to this client. They're not doing it anyway. They're being passive aggressive. So all of these negative automatic thoughts that you might have about your clients and their completion of homework could actually send some kind of message to your clients through your facial expression or body language. So pay attention to the messages that you're giving to your clients about homework. So what do you do when clients don't do their homework? Again, you may have all kinds of automatic thoughts. Gosh, not again. What's the problem? We're not really making any progress in therapy. We're going nowhere. Just watch what you're thinking when that happens. Again, there are about half of the clients who don't do homework, so that's not the end of the world. Watch out if you have a tendency to catastrophize, because it can happen all the time. So you would actually address that issue in the same way that you would address any other issues that your clients bring in. First of all, you're going to conceptualize the problem. Do you think is it like problem solving related issues? Is there problems with cognitions? Like, do your clients have some negative automatic thoughts that we need to address? Is there an issue of related to skill deficit? Like, do you need to teach some skills? Like, always just explore and not conceptualize the problem, and then, whichever way that you identify the problem, address the problem just in the same way that you would address any kind of problem in CBT. So ask like what has gotten in the way. Were there any practical problems, and then problem solve. Were there any like automatic thoughts, then identify those automatic thoughts, and then work on changing those automatic thoughts so that you can cleanse and can make progress. It's all part of therapy. It's all part of problem solving and working with your clients, identifying issues and addressing that issue. So it's just same as all the other issues that you would address in session. Today you've learned how to administer homework in CBT, and then how to address some challenges in homework compliance. To summarize, homework is an integral part of CBT, and homework can help a client improve quicker. It's helpful to understand some facilitators and barriers to homework completion. And you can use CBT skills that you've learned so far to facilitate homework completion. When you come back for our Zoom live session, we'll do some exercises, and then we'll also work on some clinical skills that you can use to facilitate homework completion. Now you can move on to the next topic for today's lecture, which is about treatment planning.